For 6 years, I kept telling one of my patients the same thing. You have an umbilical hernia. It may not be causing problem today, but please do not ignore it. Every time he smiles and gives me the same answer. Doctor, I've had it for years. It doesn't hurt. Why should I undergo surgery? Then one night, everything changed. A severe bout of coughing, sudden unbearable pain, an emergency operation. Part of his intestine had already lost its blood supply. What could have been planned one day surgery became a major emergency with an ICU care, bowel surgery, and more than a month of recovery. Today, I want to share this story because it carries an important lesson. Not to create fear, but to help people understand why some hernias should not be ignored. Hello, I'm Dr. Rajeev Pullagura, Consultant General and Laparoscopic Surgeon in Bengaluru. I see many patients with hernias, and one of the most common questions they ask is, Doctor, if this is not hurting, do I really need the surgery or you're pushing me towards surgery? Let me tell you about one patient who's experienced answers that question better than any textbook or Google or ChatGPT could ever do. Several years ago, this gentleman came to my clinic with a swelling near his belly button. It was a classical umbilical hernia. At that time, it was reducible and there was no severe pain. He could go to work and perform his activities normally, walking comfortably, eating comfortably, live his everyday life without any particular concern. After examination, I examined and I mentioned to him he has an umbilical hernia. Right now it is not an emergency, but the hernia usually does not repair itself. Planning a surgery before complication develops is often a safe option. He understood everything, but then he smiled and said, Doctor, if it's there for almost 6 years and nothing has happened, I think I will wait and think about this at a later time. I obliged. Over the next few years, I saw him multiple times. Every visit, almost identical conversation. I would ask, how is the hernia? He would reply, it's the same, doctor. It doesn't trouble me. At the same time, maybe may have increased slightly in size. Once again, I advised him not to wait indefinitely and plan for a surgery at some time. Life became busy, work came first. Family responsibility came first. Since there was no pain, surgery never felt urgent. And this is exactly what happens with many patients. When something doesn't hurt, it's easy for them to believe it is harmless. Then one day, he developed severe cough, a bout of cough because he had cold and respiratory infection. During one particular forceful cough episode, he developed sudden intense pain around the hernia. This wasn't the mild discomfort he had occasionally noticed before. The swelling became extremely painful. It could no longer be pushed back, which he was able to do previously. The pain kept increasing. He popped in some painkillers temporarily, but soon he began feeling unwell. By the time he reached the hospital, it was no longer an ordinary or a simple hernia. The intestine had come and got trapped within the hernia. More importantly, the blood supply to that segment of the intestine that was trapped had been compromised. In basic terms, gangrene. That changed everything. Instead of a planned operation, now he required an emergency surgery. During the surgery, we tried laparoscopically. We found that a portion of his intestine was no longer healthy because it has lost its complete blood supply. That segment could not be preserved. So we had to remove it. And we had a difficulty in reducing the bowel, so we had to do an open surgery. Healthy ends of the intestine were carefully joined back together via certain staplers. What could have been relatively a straightforward hernia repair had become a much larger operation because of the complication. Elective surgery is not equivalent to emergency surgery. The operation was only the beginning. Recovery was much longer than expected. He was admitted to the ICU. His hospital stay became very prolonged. Return to normal activities took weeks. His family had to rearrange work schedules. There was an additional medical expense. He lost income, severe emotional stress and physical stress for himself and his family around. When we later spoke about everything that happened, he quietly told me, Doctor, I wish I had listened to you or I had done the surgery when I could do it. Does this mean every umbilical hernia will become an emergency? No. Every patient is different. Every hernia remains stable for a very long period of time. While others develop complications early, some may develop at a later stage. The purpose of sharing this video is not to frighten anyone or push them towards surgery. It is to explain why surgeons often recommend planned treatment after carefully assessing an individual patient. A planned surgery gives you time to prepare. An emergency usually does not. If you have a swelling near your belly button, groin, or any previous surgical scar, do not ignore it simply because it is not painful. Get it examined, checked by a surgeon, understand your diagnosis, discuss the options with a qualified surgeon. Sometimes the best time to treat a hernia is before it decides for you. I hope this patient story helps someone seek medical advice a little earlier or on an elective basis. If you found this video useful, please share, like and subscribe for more evidence-based information on common surgical and medical issues. Thank you for watching. I'll catch you in the next video. Thank you.